Welcome to SSR Pharma Media, your trusted source for pharma knowledge. HAP Exam H Series MCQs for Success. So, Human Anatomy and Physiology. Today we are going to discuss about Respiratory System Part 2. Prepare, Practice, Succeed. So, we will discuss about Respiratory System. So, already we have discussed Part 1, Anatomy of Lungs and Mechanism of Respiration. Today we are going to discuss about respiratory volumes and capacities. So in this picture there are various type of respiratory volumes and capacities are there. So IRV means respiratory reserve volume, tidal volume, respiratory reserve, expiratory reserve volume, residual volume. Functional residual capacity. FRC means functional residual capacity. VC means vital capacity. And TLC means total lung capacity. So, we'll see the parameters of respiratory volumes and capacities. Tidal volume. So, it is type of air exhaled and inhaled in a normal quiet breath. So, it's a 500 ml in adult. And inspiratory reserve volume, extra air inhaled after normal inspiration. So, nearly 3100 ml. And expiratory reserve volume, extra air exhaled after normal expiration. So, nearly 1200 ml. Residual volume, the air left in the lungs after maximum expirations, nearly 1200 ml. It is not measurable by spirometry. Inspiratory capacity is the maximum air inhaled after normal expiration. So, nearly 3600 ml. It is total tidal volume and inspiratory reserve volume. So, both are combinedly called inspiratory capacity. Functional residual capacity means air remaining after normal expiration. So, nearly 2400 ml. So, it is the combinedly expiratory reserve volume plus reserve volume. Vital capacity, maximum air exhaled after maximum inspiration, nearly 4800 ml. So, it is totally inspiratory reserve volume and tidal volume plus expiratory reserve volume. So, or total lung capacity minus residual volume. So, total lung capacity means maximum air lungs can hold. So, nearly 6000 ml. That means 6 liters. And it is the containing vital capacity and plus residue volume. And dead space volume means air in conducting zone. So, no gaseous exchange takes place. So, nearly 150 ml. Minute ventilation, air ventilated per minute. So, it is nearly 6000 ml per minute. It is a tidal volume into respiratory rate. So, respiratory rate per minute 12. So, tidal volume 500. 500 into 12. It is called minute ventilation. Moving to the question. If a person takes a normal inspiration and then inhales as much air as possible, the extra volume of inhaled air is known as option A, tidal volume, option B, inspiratory capacity, option C, inspiratory reserve volume, option D, vital capacity. So, the answer is option C, inspiratory reserve volume. So, inspiratory residue volume is the additional volume. Inspiratory reserve volume is the additional volume of air a person can inhale after a normal inspiration. So, IC is equal to, IC means is the inspiratory capacity is equal to tidal volume plus inspiratory reserve volume. While VC is the vital capacity is equal to inspiratory reserve volume plus tidal volume and expiratory reserve volume. So I means inspiratory reserve volume, X means expiratory reserve volume. Next, a healthy adult exhales normally and then forcefully expels additional air. The extra air inhaled is termed option A residual volume, option B inspiratory reserve volume, option C expiratory reserve volume, option D functional residual capacity. So the answer is option C expiratory reserve volume. So expiratory reserve is the volume is the maximum volume of air that can be forcefully exhaled after a normal expiration. That means functional residual capacity is equal to expiration reserve volume plus residual volume. So this is a 1 liter, nearly 1000 ml is called expiratory reserve volume. Next, which of the following correctly matches the lungs volume with its physiological significance? Option A residual volume prevent alveolar collapse by keeping lungs partially inflated. Option B inspiratory reserve volume amount of air left in the lungs after normal expiration. Option C expiratory reserve volume extra air inspired after normal inspiration. Option D residual volume the volume measured during spirometry. So the option A is the answer. So residual volume maintains continuous gas exchange and prevent lung collapse. So inspiratory reserve volume is the extra air inhaled after normal inspiration. Expiratory reserve volume is the extra air exhaled after expiration, normal expiration. And residual volume cannot be measured by spirometry. So residual volume means it's present lower part of the lungs. It's occupy lower part of the lungs. Next, which of the following best defines total tidal volume? So option A, air remaining in lungs after maximum expiration. Option B, extra air inhaled after normal inspiration. Option C, volume of air inhaled or exhaled during normal quiet breath. Option D, maximum air exhaled after normal expiration. So the answer is option C, volume of air inhaled or exhaled during a normal quiet breath. So that tidal volume is the volume of air moved in and out of the lungs during normal and quiet breath. So nearly the tidal volume is 0.5 liter. That means 500 ml in adult. So residual volume is equal to inspiratory reserve volume equal to and expiratory reserve volume. Next, the normal tidal volume is in a healthy adult is approximately option A 150 ml, option B 250 ml, option C 500 ml, option D 1000 ml. So the answer is option C 500 ml. So tidal volume means is a 500 ml. That means 0.5 liter. It's occupied middle part of the lungs. Next, which lung volume cannot be measured by spirometry? Option A tidal volume, option B expiratory reserve volume, option C inspiratory reserve volume, option D residual volume. So the answer is option D residual volume. So residual volume is a volume air remaining in your lungs after maximum exhalation. It cannot be measured by spirometry since it cannot be exhaled. So spirometry measures air that can be moved in and out of the lungs. Since residual volume is the air that remains in the lungs even after maximum expiration. It cannot be exhaled and hence cannot be measured directly by spirometry. So it's occupy lower part of the lungs, so it cannot be measured directly by spirometry. It is the type of residual volume. Next, which of the following statement about vital capacity is true? So the answer true. Option A, VC includes vital capacity includes residual volume. Vital capacity is the volume remaining in lungs after normal expiration. Option C, vital capacity is the maximum air exhaled after a maximal inspiration. Option C, vital capacity is always equal to total lung capacity. So the answer is option C. Vital capacity is the maximum air exhaled after maximal inspiration. So vital capacity means it's a combination of these three. 3 liter plus 0.5 liter plus 1 liter. So vital capacity is equal to inspiration reserve volume plus vital volume plus expiratory reserve volume. Does not include residual volume. So residual volume remains in the lungs even after maximal expiration. So if it is not a part of lung capacity. So total lung capacity is equal to vital capacity plus residual volume. Next, vital capacity is option A, tidal volume plus inspiratory reserve volume. Option B, inspiratory reserve volume plus tidal volume plus expiratory reserve volume. Option C, total lung capacity minus residual volume. Option D, both B and C. So the answer is option D, both B and C. Vital capacity is the maximum amount of air exhaled after a maximal inspiration. So if the sum of the inspiratory reserve volume plus tidal volume plus expiratory reserve volume. So also include total lung capacity minus residual volume. So these are all total lung capacity minus this the residual volume. So this also it will come to the vital capacity. So vital capacity means answer both A and B. So next, if a person has vital capacity 4800 ml and residual volume 1200 ml, then what is total lung capacity will be? So option A 4800 ml, option B 3600 ml, option C 6000 ml, option D 7200 ml. So the answer is option C 6000 ml. So the formula is TLC, total lung capacity is equal to vital capacity plus residual volume. So vital capacity is a 4800 plus residual volume 1200. So total 6000 ml, 6 liters. Next, total lung capacity is defined as option A, vital capacity minus residual volume, option B, vital capacity plus residual volume, option C, tidal volume plus inspiratory reserve volume plus expiratory reserve volume, option D, residual volume plus expiratory reserve volume. So the answer is option B, vital capacity plus residual volume. So TLC, total lung capacity is the maximum air lungs can hold. So nearly the vital capacity plus residual volume. It's nearly 6000 ml in adult. That means it's a 6 liters in adult. So it's a total lung capacity. Next, dead space volume in a normal adult is approximately option A 50 ml, option B 100 ml, option C 150 ml, option D 250 ml. So the answer is option C, is a 150 ml is a dead space volume. So anatomically dead space volume 150 ml is the volume of conducting zone airway. So it is present nose, trachea and bronchi. So where this air does not involving in the gaseous exchange. Next, minute ventilation is calculated as tidal volume into respiratory rate, option A, option B, vital capacity divided by respiratory rate. Option C, total lung capacity divided by tidal volume. Option D, inspiratory reserve volume into expiratory reserve volume. So the answer is option A, 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 TV into respiratory rate, tidal volume into respiratory rate. So it's a minute, it's a minute ventilation means it's a tidal volume into respiratory rate. So for example, 500 ml is the tidal volume into number of breath 12. So total 6000 ml per minute, 6 liter per minute. Next, apnea is defined as option A, rapid and shallow breathing. Option B, temporary cessation of breathing. Option C, deep gasping respiration. Option D, abnormal wheezing during expiration. So the answer is option B, temporary cessation breathing. So apnea means absence of breathing, may occur in sleep apnea. CNS depression or airway obstruction. Next, which of the following respiratory condition is most likely to cause lungs collapse? Option A, hyperpnea. Option B, apnea. Option C, pneumothorax. Option D, dyspnea. So the answer is option C, pneumothorax. So pneumothorax is air enter into the pleural cavity. Negative intrapleural pressure lost. Due to that, lungs get collapsed. So other option do not cause collapse directly. Next, a patient reports difficulty in breathing after moderate exercise. So this condition is referred to as dyspnea, apnea, hyperpnea, pneumothorax. So the answer is option A, dyspnea. So dyspnea is difficulty or labored breathing. It occurs in conditions like asthma, COPD and heart failure. So next, increased depth of breathing is termed option A, apnea, option B, hyperpnea, option C, dyspnea, option D, pneumothorax. So the answer is option B, hyperpnea. So hyperpnea is a increased depth of breathing seen during exercise and metabolic acidosis and high altitude adaptation. So apnea means absence or temporary stoppage of breathing. Dyspnea means difficulty in breathing. Hyperpnea means increased depth of breathing. Pneumothorax means air in pleural cavity. Next, which lung volume cannot be measured by spirometry? Option A, tidal volume. Option B, expiratory reserve volume. Option C, residual volume. Option D, inspiratory reserve volume. So the answer you tell in comment box. So kindly join in our WhatsApp community. You will get hands-out material and test series for check your knowledge. So thank you. Like, share and subscribe.